Mr. Speaker, I talked to a dear friend of mine who I've known for many years, Mr. Speaker, and I know you know what I mean when you've known someone for years and years and years. But there's something I didn't know about this friend of mine when I had a health care forum in my district in Minneapolis a few weeks ago. I won't mention this friend of mine's name because I'm going to protect her privacy. But this friend of mine, Mr. Speaker, who I've known for years, I didn't know this fact about her. Let's call her Ann. That's not her name. Ann, after a healthcare forum that I held in my district in Minneapolis, in which 220 people showed up because they demand healthcare reform, waited around after everybody left after the healthcare forum and said she needed to talk to me. And I said, you know, Ann, sure, I'll take a minute. We can talk. And she sat me down, and this is a strong woman. She's not someone who was, you know, easily given over to tears, but she was in tears. She's only about 37, 36 years old, and she has a beautiful family, and she's just a great person all around. Anyway, Ann sat me down, and she looked me straight in my eye. When she looked me in the eye, I knew, Mr. Speaker, that she was serious, 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 serious. And what she said to me, Mr. Speaker, was this: that I'm on my job and I have a health insurance at my job. But members of my family, including my sisters and my mom, have had breast cancer. And Mr. Speaker, she told me that she is afraid to go get a test to determine whether she may develop breast cancer, because if she gets this test, Mr. Speaker, then a healthcare company might decide she has a pre-existing condition and then drop her from the policy. But if she doesn't go find out, Mr. Speaker, if she might develop breast cancer, she can't get treatment that she needs that may save her life one day. And she's a young mom. She's only about 37, 36 years old, and she has kids who she's trying to raise. So, Mr. Speaker, imagine being in the case where you can't go get the test to find out whether you have breast cancer, because if you do, that's going to be a pre-existing condition, and yet you can't afford not to do it, because if you don't do it, like your mother and your sister, you may develop breast cancer. This is a system that these folks who are standing in the way of reform are trying to preserve. And, Mr. Speaker, it is wrong. It's time for reform to take place, and the time for reform is now. Reform will alleviate the burden on families by lowering costs. Reform will alleviate the burden on our economy by creating more efficient insurance and delivery system, which will reduce waste and allow more rational financing system where everyone contributes, including instead of shifting costs from some people onto others. Reform will alleviate the burden on business that is hindered in their ability to compete because of these enormous health care costs. Mr. Speaker, we got to have a public option. I explained the public option a moment ago. A public option is just one of other health insurance coverage programs that will be offered on the exchange. But, Mr. Speaker, the public option needs to be understood. It means, and what the public option is giving the uninsured an option to enroll in a public health care plan that's like Medicare. The public insurance option would compete directly with health care insurers. Why are they afraid to compete? What are they scared of? The uninsured individuals would get to choose which plan is best for them, which could be a private one or the public option. Why is having a public option so important? A broad array of research has confirmed that a public health insurance option is a key component of cost containment because it will introduce more competition, something conservatives say they like whenever it makes them exorbitant money. It'll lower administrative expenses. I talked about the medical loss ratio a moment ago of 85%. I have a bill personally that will raise it to 90, which I think would be better. Medicare would still outcompete them because they do better than that, and drive cost-saving innovation. According to research from the Commonwealth Fund, the net administrative costs for Medicare and Medicaid were 5% and 8% respectively. That's why I think a medical loss ratio of 90% would be good. They should be able to do it. If you look up the top 5 health insurance companies, Mr. Speaker, their administrative costs were 17%, and the average administrative cost for private insurance is 14%. The fact is, they're inefficient, they like it that way, and they don't want to change. But a public option would make them change. It would make them change, Mr. Speaker. Members of the Congressional Progressive Caucus signed a letter to Speaker Pelosi and the Democratic leadership clearly stating that a robust public option must be in the mix. This year in the Congress, we must act on health care reform, and that health care reform must include a public option. We believe that only a health care plan with a robust public option will provide more Americans with greater access to treatment and doctors with less interference and obstruction from big insurance companies and other profit-driven special interests. Mr. Speaker, if you listened to the hour just before I came on, you heard people spinning scenarios and imaginary ghosts and demons and goblins in the air in which a patient would have a government bureaucrat, their word, in between the doctor. Well, that hasn't happened. That's imaginary. It's not going to happen. But now, today, a patient has to deal with a bureaucrat in an insurance company before they can get the medical treatment that they need. Their claims have been excluded. Some bureaucrat has said, oh, we're not going to approve that. Oh, we're going to deny that. Oh, we're not going to allow that procedure to happen, even though a doctor has recommended it. That's reality. What they were talking about an hour ago was fantasy, and it's kind of like on Freddy Krueger order, nothing but a nightmare and a scare and a horror film. We urgently need to fix health care for American families. Every day, Americans worry not simply about getting well, but whether they can afford to get well. Millions of Americans wonder if they can afford the routine care to stay well. Premiums have doubled over the last 9 years, 3 times faster than wages. Okay, 3 times faster than wages. The average American family already pays an extra $1,100 in premiums every year for a broken system that supports 46.5 million uninsured Americans. We need the change for American business. Soaring health care costs put American companies at a competitive disadvantage in a global economy. Small businesses are forced to choose between coverage and layoffs. That's a choice they should never have to make. But what about the fiscal future of America? We have the most expensive health care system in the world. We spend almost 50% more per person on health care than the next most costly nation. And we're no healthier for it. We're spending all this money, Mr. Speaker, but we're not healthier for it. If you look at national rankings of Americans' health and wellness, we're not at the top, although spending is at the top. We're at the bottom when it comes to diabetes, when it comes to heart disease, when it comes to cancer, when it comes to all these critical things, Mr. Speaker. What are we going to do about it? We better step up and do something, and that something cannot wait. If we do nothing, in a decade, we'll be spending 1 out of every $5 on health care. In 30 years, it'll be 1 out of every 3. Health care reform is necessary, and it's deficit reduction, because reform will drive down costs.